name is Caitlin. I'm going to be performing my oral and topical medication administration checkoff today. I'm going to be administering some medications for the patient George Monster Jones. His date of birth is 10/1XX. I have two medications here that I'll be administering. The first one is nitroglycerin ointment, 2% half inch to the chest wall stat, and the second is furosemide 60 milligrams PO now. He does have an allergy to penicillin, but there's no contraindications between those two medications and penicillin. So now I'm going to go ahead and make sure that I have the correct medications here. I have nitroglycerin ointment, 2%, half inch to the chest wall. I have my demi-dose patch here, so I will squeeze out half inch of the nitro ointment here to administer. And again, that is a stat medication, so I'll be giving that within the 30-minute time frame. And it is now 11:30. And then my second medication here is furosemide 60 milligrams PO now. The pharmacy has supplied me with 20 milligrams of furosemide, so I've done my dosage calculation, and I will be giving 3 tablets of the 20 milligrams of furosemide. I'm going to go ahead and just make sure I have the correct medication here. Furosemide, 60 milligrams. I have a 20 milligram. Furosemide, 60 milligrams. I have another 20 milligram. And furosemide, 60 milligrams, and I have another 20 milligram. So that totals my 60 milligrams of furosemide. Again, that is a now order, so I'll be giving that within my 90-minute time frame. And again, it is 11:30 at this time. I have my pill cup here, and I also have water for the patient to swallow his medications. So now I'm going to perform my second med check outside of the patient's room. All right. So again, I'm going to be giving medications for the patient George Monster Jones, date of birth 10/1XX. He has an allergy to penicillin. I'll be giving nitroglycerin ointment 2% half inch to the chest wall stat and furosemide 60 milligrams PO now. There's no contraindications between those two medicines and the penicillin. I'll be giving nitroglycerin ointment, 2% half inch to the chest wall stat. And I have my demi-dose paper here. I'll squeeze out half inch of the nitro ointment and administer that medication. And I'm within my 30-minute time frame, as it is now 11:31. And I have my furosemide 60 milligrams PO now. Again, the pharmacy only supplied me with 20 milligrams today, so I did my dosage calculation, and I'll be giving 3 of the 20 milligram tablets of furosemide. So I'm just make sure I have the correct medication here. Furosemide, 60 milligrams. This is a 20 milligram. Furosemide, 60 milligrams. I have another 20 milligrams. And furosemide, 60 milligrams and another 20 milligrams. And that totals 60 milligrams of furosemide. I have my medication cup here, and I also have my water for my patient to swallow his meds. Now I'm going to enter the patient's room. Knock, knock, knock. Hey, Mr. Jones, my name is Kate. I'm going to be your student nurse today. I'm going to be administering some medications for you, okay? I'm going to go ahead and provide us some privacy here. And I'm going to bring my med card over here to the side of your bed. I'm going to perform hand hygiene first, okay? All right, Mr. Jones, I'm going to go ahead and lower the side rail and raise the bed to a good working position for me. Mr. Jones, I just want you to verify your full name and date of birth for me, okay?
George Monster Jones, 10/1XX.
Okay, George Monster Jones, 10/1XX. I'm going to verify that against your arm bracelet, George Monster Jones, 10/1XX. Okay, thank you so much. All right, Mr. Jones, so I'm going to be administering some nitroglycerin ointment today and some furosemide. So the nitroglycerin ointment is going to help with your chest pain, and the furosemide is going to help with your swelling. I have a few questions for you first. Have you been experiencing any chest pain today?
Yes.
Okay. On a scale of 0 to 10, with 0 being no pain at all and 10 being the worst pain that you've ever had, how would you rate your pain?
6.
A 6? Okay. Well, this nitro ointment should definitely help with that chest pain, okay? And I went ahead and checked your blood pressure. It's within normal limits of 120/80. I've also checked your potassium levels, and they're within normal limits as well, within 3.5 to 5. I've assessed your daily weight. Your daily weight is within normal limits as well today. And I'm going to be assessing the PQRST scale. So the P is for what provokes your pain, the Q is the quality of the pain, the R is the region of the pain, and the S is the severity of the pain, and the T is for timing of the pain. Can you tell me where your pain is today?
In my right upper chest.
Your right upper chest? Okay, thank you so much. So now I'm going to go ahead and just make sure that I have all the correct medications here before I administer them for you, okay? All right, so I'm going to be administering your nitroglycerin ointment first since it is a stat medication. I'm going to do my third med check here. I have nitroglycerin ointment, 2%, 2%, ½ inch to the chest wall stat, and I have my demi-dose paper here. I'll be giving that ½ inch to the chest wall stat. I'm going to go ahead and write my name and the time, 11:35, and the date. All right, and I'm going to go ahead and then put on some gloves first. And Mr. Jones, can you just verify, do you have any allergies that you know of?
No. Oh, yes, actually, penicillin.
You're allergic to penicillin? Okay, that's what I have here. So neither one of these medications are contraindicated for your allergy to penicillin, so these will be okay to give to you, okay? All right, so again, I've already done my third med check for the nitroglycerin ointment, so now I'm going to go ahead and squeeze out ½ an inch here. And I'm going to fold this over. Okay. Now, Mr. Jones, I'm just going to lower your gown here so I can look at your chest and your arms and everything. I don't see any irritation, and you don't have any other patches at this time. So I'm going to go ahead and place this nitroglycerin ointment patch on your right upper chest, okay? Okay, and now I'm going to tape that down so that it doesn't fall, okay? Put one more piece of tape down here on the bottom. Okay. All right, Mr. Jones, I'm going to go ahead and cover you back up here. All right. So now I'm going to dispose of my gloves and perform hand hygiene again. Okay, Mr. Jones, so now I'm going to be administering your furosemide. Like I said, that's for your swelling, so that should help with your, help reduce the swelling. I'm going to make sure that your bed is raised up good. Okay, and do you have any difficulty swallowing at all?
No.
No? Okay, perfect. All right, so now I'm going to go ahead and put on some more gloves here. And again, this is my third med check. I'm going to be administering the furosemide 60 milligrams PO now. I'm still within my 90-minute time frame, again, as it is 11:37. So I have my furosemide here. So I have furosemide, 60 milligrams. I have a 20 milligram. Furosemide, 60 milligrams. I have another 20 milligram. Furosemide, 60 milligrams. I have another 20 milligram. And I've already done my dosage calculation, and I have to give 3 of the 20 milligram tablets of furosemide. And again, that's by mouth right now. So I'll be administering that. And you said you don't have any difficulty swallowing. So I'm going to go ahead and pop my medications into the med cup. Okay. And I have you some water here, Mr. Jones. So you can just go ahead and take your medications whenever you're ready. And I have your water here for you to swallow it down with. All right, thank you so much. So now I'm going to go ahead and dispose of my med cup and my and the water cup. And I'm going to dispose of my gloves. Mr. Jones, before I leave today, I have a few things that I want to let you know about. So with the nitroglycerin ointment, it can cause you to have a headache. So if you do have a headache, I want you to let me know. And it can also cause you to have some dizziness and cause your blood pressure to drop. And also with the Lasix, it can also cause you to have to urinate more frequently, so you may have to get up and use the bathroom. It can also cause you to have low blood pressure as well. So with that being said, I'm going to give you your call light here. And if you need to get up and go to the bathroom, or if you need to get up or anything for any reason, just make sure you press that call light and I'll come in to help you get up out of the bed. And also, just again, let me know if you have any pain or anything like that, okay? So I've given you your call light. I'm going to go ahead and raise your bed rail here. And I'm going to lower the bed back down into the lowest position. Alright, and I'm going to perform hand hygiene again. Okay, Mr. Johnson, I'll be back in to check on you shortly, okay? And I'm going to come out here now. Now I'm outside of my patient's room. I'm going to go ahead and document my medications. So my furosemide, 60 milligrams PO by mouth now, I gave that as 11:37. So 11:37. And my initials, I'm going to draw a line through it. And then the nitroglycerin ointment, I'm going to put my initials here and the time, 11:37, and I gave that in the right upper chest, so RUC, and also my initials here, and I'm going to sign my name, comma SN for student nurse. Okay, and now I'm going to let you look at my documentation there.